Okay. I guess you've already seen the title slide. That's where the video will go. Anyways, according to the American Psychological Association, psychiatry is a branch of medicine focused on diagnosis, treatment, and prevention of mental, emotional, and behavior disorders. So, essentially, what a psychologist is it's a medical doctor who's done residency in psychology. So, essentially, you obviously have to graduate high school and then you go to college and you major in pre med or like microbiology or depending on the college because some colleges don't have pre med programs. But anyways, after going to college, you go to medical school and you become a licensed physician, and then you do your residency in psychology. So essentially, there's a lot of confusion between the difference between a psychologist and a psychiatrist, and since I'm presenting psychiatry, we'll talk about that. So a psychologist is just a person who's gone to college, like for example, University of Montana, and they've just gone into the PhD program for psychology. Whereas a a psychiatrist has done the whole DOMD thing, and they've done residency training. So the main difference is, except in the states of like Arizona and New Mexico, psychologists cannot prescribe medication to patients. You would have to go to a psychiatrist to do that. So, since psychiatrists are physicians, they can order a full range of medical laboratory and physiological tests, which you can combine with patients' help, provides an overall picture of how a patient's doing mentally, emotionally, physically even too. So a psychologist on average is going to spend about 2/3 of their time with patients, and then the rest is just going to be doing filing and putting things in patients' medical reports and etc. etc. So here it is. They can use a full range of medical tests and their diagnoses. There's this giant handbook called the American Psychological Association Diagnostic and Statistic Manual of Mental Disorders, 5th edition. It's like this big. It's pretty cool, actually. And it has every single mental disorder ever listed in there. And they cross-reference any diagnoses they have with this book. So psychiatrists can use a variety of treatments like psychotherapy, medications, or interventions or other treatments, such as electroconvulsive therapy, which is where you shock them. So it depends on the needs of the patient. So psychotherapy is just called talk therapy, and that's what we mostly focus on when we would be working with a patient like this, because it seems like he has some kind of lack of motivation. Now, this may be caused by some sort of mental illness like depression, bipolar, etc., but it may just also just be a lack of interest. So what we do as a psychiatrist, and with a reflection, we meet with the patient day by day, and we just observe their behavior. Like a psychiatrist would talk with them and see how they're doing. And it also helps coping with stress, because for a lot of people, it can be very stressful when you go from eating junk food and drinking coffee and doing all these unhealthy habits to all of a sudden having to eat totally healthy. It's a giant culture shock for most people. So a psychiatrist would really just help with motivation and coping with stress. Yeah, that's it.